Hi everyone, I'm going to talk about diabetes, which is the most dangerous disease. It's a lifestyle disease and it has caused harm to many. Welcome. There are two major types of diabetes, and the causes and risks factors are different for each type. Type 1 diabetes. In type 1 diabetes, the body stops producing insulin or produces too little insulin to regulate blood glucose level because of progressive failure of the pancreatic beta cells. It can occur at any age, but it is most often diagnosed in children, the teens, or young adults. Daily injections of insulin are needed. That exact cause is not known yet. Type 2 diabetes. Although the pancreas still secretes insulin, the body of someone with type 2 diabetes is partially or completely unable to use this insulin. This is sometimes referred to as insulin resistance. It makes up most of diabetes cases. It most often occurs in adulthood, but teens and young adults are now being diagnosed with it because of high obesity rates. Allow me take you through the complications of diabetes. 1. Damage the retina from diabetes. This is diabetic retinopathy. That's how it can be called. The damage to the retina from diabetes is a leading cause of blindness. Damage to the kidneys from diabetes, which is normally called diabetic nephropathy, is a leading cause of kidney failure. We also have number 3, damage to the nerves from diabetes, and this is called diabetic neuropathy. This is a leading cause of foot wounds and ulcers, which frequently lead to foot and leg amputations. Number 4, damage to the nerves in the autonomic nervous system, which can lead to paralysis of the stomach, chronic diarrhea, and inability to control heart rate and blood pressure during postural changes. Number 5, diabetes accelerates atherosclerosis, that is the formation of fatty plaques inside the arteries, which can lead to blockages or a clot, which is normally known as thrombus. Such changes can then lead to heart attack, stroke, and decreased circulation in the arms and legs. This one we can call it peripheral vascular disease. Number 6, diabetes predisposes people to elevated blood pressure, high levels of cholesterol, triglycerides, and these conditions, both independently and together with hyperglycemia, increases the risk of heart disease and kidneys. We have stem cell STC 30 for diabetes 1 and 2. Currently, available treatment or medicines, diet, insulin injection, and exercise can control blood sugar but cannot cure diabetes. Over the past several years, doctors have attempted to cure diabetes type 1 and 2 via transplanting functional insulin-producing beta islet cells and pancreas from donors. However, the requirements for steroid immunosuppressant therapy to prevent rejection of the pancreatic cells increases the metabolic demand on insulin-producing cells, and eventually they may exhaust their capacity to produce insulin and also show deleterious effects on pancreas cell and shows less successful results. Therefore, stem cell therapy is another most effective treatment for diabetes mellitus because scientists have already proved that double stem cell or STC30 stem cells can be differentiated into pancreatic beta islet cells. Diabetes is metabolic and autoimmune disease, means our body attacks to our own pancreatic cells as foreign cells, so the treatment with stem cells, that is double cell or double stem cell STC30, provide immune regulatory properties and stops the immune attack by secreting anti-inflammatory cytokines. Stem cell treatment shows good improvement in diabetes patients because double stem cell STC30 has the capacity to regenerate the beta islets cells. Allow me give you key notes or key points to diabetes type 1 and diabetes type 2 patients and the wonders of STC30 for them. Let me start with diabetes type 1. Number 1. Stem cell can differentiate or regenerate into pancreatic beta islet cells, so produce more insulin. Number 2. Stem cell therapy also differentiates into new vascularization, so it provides good environment for beta islet cell regeneration. Point number 3. Stem cell provides immune regulatory properties by secreting anti-inflammatory cytokines and stop inflammation into the pancreas cells. Let me now talk about the patients with type 2 diabetes and the stem cell therapy product STC30. Patients with type 2 diabetes have both insulin resistance and insulin deficiency, so stem cells can regenerate into functional beta islets. Number 2. After stem cell migration to the injured and dysfunctional area, it repairs, regenerates that area, so stem cell therapy reduces the resistance property of fat, liver, and muscle for insulin. Point number 3. Stem cell therapy creates immune regulatory property. So, stem cell therapy is a wonderful treatment for both type 1 and type 2 diabetic patients. For those ones who haven't watched my previous videos, kindly visit my YouTube channel, view, like, comment, share, and subscribe for more videos. Bye bye.